Never catch the flu again. Imagine how it would be if you could prevent the flu and strengthen your immune system effectively and practically. If you're tired of suffering from the uncomfortable symptoms of the flu, this video is for you. Let's explore 7 infallible and proven tips to prevent the flu and increase your immunity. These tips are based on scientific evidence and are easy to implement in your daily life. So, get ready to strengthen your natural defenses and say goodbye. If you liked the video, don't forget to leave a like and subscribe to the channel to receive more content like this. Now, let's get to the tips. Have you ever felt that unpleasant sensation of the flu approaching? Symptoms like fever, headache, cough, and stuffy nose can be extremely uncomfortable and even incapacitating. The good news is that there are measures we can take to prevent the flu and strengthen our immune system, making us less likely to contract the disease. Let's explore some of these measures together. The flu, also known as influenza, is a highly contagious viral infection that affects the respiratory system. It is caused by the influenza virus and is characterized by symptoms such as fever, headache, muscle aches, dry cough, extreme tiredness, and sometimes sore throat and runny nose. The flu can range from mild to severe and can lead to serious complications, especially in elderly people, young children, and people with pre-existing medical conditions. That's why it's so important to take measures to prevent the flu and protect our health and the health of those around us. But what can we do to prevent the flu? There are several measures we can take to reduce the risk of contracting the disease and strengthen our immune system. Some of these measures include maintaining a healthy and balanced diet, practicing good hygiene, avoiding close contact with sick people, and staying home when sick. In addition, there are several vaccines available that can help prevent the flu and other viral infections. Let's explore 7 100% proven measures to say goodbye to the flu, and you will also learn a powerful juice recipe to increase your Measure 1: consumption of citrus fruits. Citrus fruits, such as oranges, lemons, and tangerines, are known to be a rich source of vitamin C, an antioxidant vitamin that plays a crucial role in the immune system. Vitamin C, also known as ascorbic acid, is necessary for the production of collagen, an essential protein for the health of the skin, bones, cartilage, and connective tissues. Regarding the prevention of the flu, vitamin C plays an important role in immune function, as it stimulates the production of white blood cells, which are responsible for fighting infections. Studies show that supplementation with vitamin C can reduce the duration and severity of symptoms of the common cold, which is caused by viruses similar to the flu virus. In addition, vitamin C can help reduce the risk of contracting the flu by strengthening the immune system and protecting cells from damage caused by free radicals. In addition to vitamin C, citrus fruits are also a good source of other important nutrients for health, such as potassium, folic acid, calcium, fiber, and antioxidants such as flavonoids and carotenoids. These nutrients help promote good cardiovascular health, reducing the risk of high blood pressure, heart disease, and stroke. In addition, citrus fruits are also rich in water, which helps maintain hydration and regulate body temperature. However, it is important to note that the consumption of citrus fruits is not a guarantee that you will not contract the flu. There are many factors that contribute to the development of the flu, including exposure to the virus, genetic susceptibility, and the strength. Measure 2: garlic consumption. Garlic is a plant known for its use in cooking and its medicinal properties. The bulb is the most commonly used part. Several scientific evidences suggest that garlic may have antimicrobial, antiviral, anti-inflammatory, antioxidant, and immunomodulatory properties. These effects are attributed to various compounds present in garlic, such as allicin, agenin, diallyl disulfide, diallyl trisulfide, S-allylcysteine, and derivatives of caffeic acid. A study published in the Journal of Antimicrobial Chemotherapy in 2004 showed that garlic has antibacterial activity against various strains of pathogenic bacteria, including Escherichia coli, Staphylococcus aureus, Streptococcus pneumoniae, and Salmonella typhi. In addition, a study published in Phytotherapy Research in 2009 showed that garlic has antiviral activity against various types of viruses, including the flu virus, influenza. Allicin, one of the main bioactive compounds in garlic, is known to have antioxidant and antimicrobial properties. It is formed from allinase, an enzyme that is activated when garlic is cut or crushed. In addition, allicin and other sulfur compounds present in garlic have been associated with the stimulation of the immune system. A study published in the Journal of Ethnopharmacology in 2015 showed that garlic extract can increase the activity of NK cells, natural killer cells, which are immune system cells that play an important role in defense against viral infections and cancer. Another study published in International Immunopharmacology in 2014 showed that garlic can increase the production of cytokines, which are proteins involved in the regulation of the immune response. In addition, a study published in the Journal of Nutritional Biochemistry in 2006 showed that garlic can increase the production of glutathione, an endogenous antioxidant that is important for the health of immune system cells. Based on these evidences, garlic can be considered an option for prevention and assistance in flu recovery. However, it is important to note that studies on the effects of garlic on the prevention and treatment of flu are limited and more research is needed to confirm these effects. Measure 3. Ginger consumption. Ginger has been used for centuries in both cooking and traditional medicine in various cultures. Ginger is known for its spicy flavor and distinctive aroma, and has been used in various forms, including fresh, dried, powdered, as extract, and as oil. The main bioactive compound in ginger is gingerol, which is responsible for the characteristic spicy flavor of ginger. Gingerol has antioxidant, anti-inflammatory, antimicrobial, and antiviral properties. It is formed from zingerone, which is converted into gingerol through a decarboxylation process when ginger is processed. A study published in the Journal of Ethnopharmacology in 2011 showed that gingerol has antibacterial activity against various strains of pathogenic bacteria, including Escherichia coli, Staphylococcus aureus, Streptococcus pneumoniae, and Salmonella typhi. In addition, a study published in the Journal of Medicinal Food in 2014 showed that gingerol has antiviral activity against various types of viruses, including the flu virus, influenza. In addition, gingerol has anti-inflammatory properties that can help reduce inflammation in the respiratory tract, which can be useful for relieving flu symptoms such as sore throat, cough, and nasal congestion. In addition, gingerol can stimulate mucin production in the respiratory tract, which can help relieve nasal congestion and cough. Ginger also contains compounds such as gingeroids and showgales, which have antiemetic properties that can help relieve symptoms of nausea and vomiting associated with the flu. Based on these evidences, ginger can be considered an option for prevention and assistance in flu recovery. However, it is important to note that studies on the effects of ginger on the prevention and treatment of flu are limited, and more research is needed to confirm these effects. In addition, excessive consumption of ginger can cause gastrointestinal discomfort, such as gas and abdominal pain, and may interact with certain medications. Therefore, measure 4th honey consumption. Honey is a natural food produced by bees from the nectar of flowers. It is known for its medicinal properties and its sweet and pleasant taste. Honey is mainly composed of fructose and glucose, in addition to water, minerals, vitamins, and antioxidant compounds. Honey is a rich source of antioxidants, such as flavonoids and polyphenol. In addition, honey contains antimicrobial compounds, such as peroxide acid, which can help fight bacteria, fungi, and viruses, including the flu virus, influenza. In vitro studies suggest that honey has antiviral activity against various types of viruses, including the flu virus. Moreover, honey has anti-inflammatory properties, which can help reduce inflammation in the respiratory tract and relieve flu symptoms such as sore throat, cough, and nasal congestion. In addition, honey has humectant properties, which can help relieve dry cough. Honey is also a rich source of energy, providing a quick source of fuel for the body. It is mainly composed of simple sugars, such as fructose and glucose, which are easily absorbed by the body and can help relieve symptoms of weakness and fatigue associated with the flu. Based on these evidences, honey can be considered an option for prevention and assistance in flu recovery. However, it is important to note that studies on the effects of honey on the prevention and treatment of flu are limited, and more research is needed to confirm these effects. In addition, excessive consumption of honey can cause gastrointestinal discomfort, such as gas and abdominal. Measure 5. Consumption of red berries. Red berries, such as strawberries, blackberries, and raspberries, are a rich source of antioxidants, such as anthocyanins, flavonoids, and vitamin C. Red berries also contain anti-inflammatory compounds, such as quercetin, which can help reduce inflammation in the body and relieve flu symptoms such as sore throat, cough, and nasal congestion. In addition, red berries are a rich source of vitamin C, a powerful antioxidant that plays an important role in the immune system. Vitamin C stimulates the production of white blood cells, which are responsible for fighting infections. In addition, vitamin C can also help reduce the duration and severity of symptoms of the common cold, which is caused by viruses similar to the flu virus. Based on these evidences, red berries can be considered an option for prevention and assistance in flu recovery. However, it is important to note that studies on the effects of red berries on the prevention and treatment of flu are limited, and more research is needed to confirm these effects. Therefore, it is important to consult a healthcare professional before using red berries to prevent or treat the flu. Measure 6. Regular hand washing. Proper hand washing with soap and water is one of the most effective measures to prevent the spread of infectious diseases, including the flu. This helps remove viruses and bacteria from the hands, thus reducing the risk of infection. It is also important to dry the hands completely, as moisture can increase the survival of viruses and bacteria. Hand washing should be done regularly, especially after using the bathroom, before eating, and after touching potentially contaminated surfaces, such as handrails and doorknobs. For best results, it is recommended to scrub the hands for at least 20 seconds, making sure to wash the palms, backs of the hands, between the fingers, and under the nails. Measure 7. Use of hand sanitizer. Hand sanitizer is an effective disinfectant against viruses and bacteria, including the flu virus. It is especially useful when hand washing with soap and water is not an option. It is recommended to use hand sanitizer with at least 60% alcohol to ensure its effectiveness. To properly use hand sanitizer, apply enough to cover all surfaces of the hands and rub until the hands are dry, which usually takes about 20 to 30 seconds. Make sure to cover all areas of the hands, including the palms, backs of the hands, between the fingers, and under the nails. Keep in mind that hand sanitizer can dry out the skin with frequent use, so it is important to use a moisturizer after use. Hand sanitizer is a great option to keep hands clean and prevent the spread of infectious diseases, such as the flu. However, it is important to note that hand sanitizer should not replace proper hand washing with soap and water when this option is available. Finally, learn the powerful juice to boost your immunity, incorporate it daily into your routine, and see the benefits happen. Citrus fruit and ginger juice. Ingredients: 1 orange, 1 lemon, 1 tangerine, 1 tablespoon of honey, ginger, a small amount, to taste. Ice is desired. Preparation method: 1. Squeeze the juice of the orange, lemon, and tangerine into a blender. 2. Add honey, chopped ginger, and ice and blend until smooth. 3. Serve immediately and enjoy the benefits for your immunity. With these infallible tips, you will be ready to face the flu season with a strengthened immune system and ready to fight any infection. Remember to maintain a healthy diet and practice good hygiene to prevent the flu and other infectious diseases. And don't forget to subscribe to the channel for more health and wellness tips. Thank you for watching and see you next time.